Today I'm on time, but maybe I'm thinking next time we'll try to do at 3 o'clock because there are a lot of patients waiting then if we do at 2:30. So let's see how does it happen. Just see the timing which I write on the post on the template so that you can join in early. So let us go forward and understand some other rubrics, some medicine or some of the questions which basically you ask regarding either the repertory or the mater medica. But let me tell you that it is very important for you all to read organon also. Yeah, welcome Dr. Vishaka. The organon which I had read maybe 20-30 years back, and now when I read organon, I can understand it much better, and I can understand the concept what Master Hahnemann wanted to tell regarding the disease, the repetition, the doses, the case taking and all. So my sincere request, because in a live or in a webinar, I've never seen organon being taught. So my humble request to everyone, read organon also, because normally I teach only mater medica and repertory because I hardly get any questions regarding organon or LM potency also. I'll just discuss the case. If there are no questions, I'll discuss the case of arthritis. Now, arthritis, as you know, is an autoimmune condition, and the patient comes to us normally after taking a lot of orthodox flow of medicines, and the patient is on steroids, and the patient comes and asks us, sir, will it get cured with homeopathy? The first question the patient asks. This the patient will never ask to a allopathic doctor. And after a month, the patient comes to you and says, sir, there is no change. I have heard that homeopathy will take out the disease from the root, and it works very fast. These are the normal questions which the patient comes and asks after they have taken all other treatments. The last is homeopathy, and they expect that the result should be within 2 days, 3 days. So again, I had a case, a very interesting case of arthritis on steroids. Arthritis was since 5 to 6 years, and the patient, during the whole case, the case taking was going on, and when the patient came to me, when my assistant asked, then the patient came to me, and the patient, I asked, how is the disease and how is, I'll just complete the thought, Dr. Padne, and then I'll get to the question. The patient told me, sir, now I want to get cured. It is like either the disease wins or I win. I have a lot of stiffness, but still I do anything to remove that stiffness. I walk, though with pain, I walk because I want to win the situation. I want to beat the disease. It is either the disease remains or I remain. This was the wording of the patient. So just tell me what will you take for prescription, and that was a very fantastic case. He's on treatment for the past 6 to 7 months. We have stopped all the painkillers, all the steroids, and the patient is on homeopathic treatment on placebo with 2 or 3 doses of the indicated medicine. Just see the case, how the patient talks, and how will you come to the simillimum, and how will you come to a rubric. If you have seen my rubric, burden wala rubric आपने दिखाऊंगा. That is also a very interesting case which I have shared on my Instagram live. So if you are having Instagram or YouTube, you can basically you can go on my Instagram page and see that video. So I had put a video of Cicuta virus also. Very interesting videos. Make sure that you see these videos also. Now there's a question with Dr. Ram Prasad. Now there's a good afternoon, sir. The patient age 50 years suffering from numbness in thighs area, better by massage and heart pressure. Now, Dr. Ram Prasad, this is a very, very common symptom in most of the cases. Any patient, a lady comes to you and he says, sir, lot of pain and I do massage, or I tell my housemate to do massage, my husband to do massage, or my do massage, I feel much better. Now, any pain, if it is better by massage, don't take, if you take that rubric for prescription, there are only few medicines, which will come to your repertory chart. Rather than that, please take other symptoms for prescription which are important. For example, you have taken numbness. Now, numbness, is a very important symptom. because maybe there are a lot of loss of blood supply or a lot of other things also. But first I'll tell you, better by heart pressure. Now there's a fantastic rubric in the repertory, a complete repertory. Uh, Pain in the extremities or pain anywhere, better by massaging, especially with hand. Now that contains 3 or 4 medicines which I remember now, and these medicines are very very common which I use. This is calcarea carb, natrum carb, ruta, pulsatilla, and I think phosphorus is also there. So better by massage, especially with the hand. Then you have to take the rubric by gentle massage or by heart pressure. By gentle massage, then we have medorinum, lysine, and I think croton tick. The same symptom of croton tick, that itching is better by just rubbing. Okay, so this is basically the massage part of it, which you feel you will come to in your practice. After 30 years of practice, I know these are very common and repetitive symptoms. Now we'll talk something about numbness, and then we'll try to take out the remedy, my dear friend. Now you have told that numbness of the extremities. Now this is again a very very big rubric. Then you can numbness. You have remedies like rust tox. We have lycopodium. We have opium, gelsemium, carbon sulf, guaiacum, agaricus. Lot of remedies. Now you have to break that and tell numbness which part, left side or right side. For example, numbness in the extremities, left side, we have causticum, we have medorinum, we have tarantula. I remember this case, numbness of left side, because in that case I had failed with 3 or 4 medicine. The patient was with me for 4 to 5 months, no change. Then I prescribed the patient a very rare medicine, sumbul. I must have taught you sumbul maybe sometimes. Sumbul treated that case. A very interesting symptom of sumbul, the patient had numbness of the left side and numbness while lying. Both the rubrics, both the symptoms are present in sumbul, and sumbul treated that case. Hello, Dr. Babal. So of course, this is okay, Dr. Ram Prasad. The numbness part and the rubbing part, if you club to both the rubrics, you will have 3 or 4 medicines in your repertory chart. Make a video on diabetic nephropathy. Okay, I will make a video on diabetic nephropathy. Now don't ask me best cure for nephropathy, because I am not that type of patient who's a doctor who's basically treating for specifics. I've always told you that in nephropathy, try to treat the cause. Diabetic nephro. So if the diabetes patient, if the sugar is on baseline for long, automatically the nephropathy starts getting better. The peripheral circulation starts getting better. So if you are basically a case of diabetic nephropathy or neuropathy, make sure that you basically treat the basic cause rather than the result of disease. In diabetic neuropathy, one thing you have to remember, I have had a lot of cases where I have started the treatment with insulin in potency, and then I have tried to get the Semlimum medicine. In diabetic neuropathy, if it is old age and you are not getting any symptom, in that case you must think about Ginkgo biloba. Yes, it is a very rare medicine, a circulatory medicine which can increase circulation in the peripheral blood vessels. The remedy is Ginkgo biloba. I normally use Ginkgo biloba in low potency, 6 potency or 12 potency. There is one more medicine that you can think about in trituration, and that is vanadium. If I use vanadium, I basically use it for vanadium in 6x potency. Okay, and other remedies which you can think about in neuropathy, especially in old age, is also Brata Mure, and also a remedy called as theosinamide prepared from mustard seeds. So these are specifics you can use, you can try, but the basic results will you get, you have to take a good case taking and treat the primary cause of neuropathy, that is diabetes mellitus. Now the question arises whether sugar can be treated or controlled with homeopathy. The answer is yes. I have a lot of cases where I have not allowed the patient to take any allopathy medicine since day one when the sugar was 250 also, and they are now much better on homeopathy treatment. The sugar is controlled for the past 6 to 8 months, no medicines. So treat the cause, and then acute medicines, if you want to use, you can use those medicines. Okay, I hope this is clear, everyone. Yeah. For increasing the height, I have not used any medicine for increasing the height. If a patient comes to me for increasing the height, if the patient is a young patient, 10 to 12 years of age, I normally try and give the constitutional medicine and then automatically it will work. But I have never given any specific medicines for increasing height, nor any patent medicines which are available in the market to increase the height. I have never used it, so I am not able to answer this question. Best for diabetes in placenta, human. No, I have never used this medicine for diabetes. Best medicines, I have told you that best medicine, all medicines are best, but that medicine has to treat the patient as a whole. That is very, very important. So I was telling you something about numbness. I hope in numbness, one or two things which you must take care about, Dr. Saab, I just forgot because there were a lot of questions. Do think about zincum metallicum also, and do think about selenium also. I have got good results in with these medicines also. Okay, so this is taken care. Most of the questions are answered. Diabetic neuropathy, I hope you understood the indications of rare medicine and when to prescribe. And these rare medicines basically I have prepared in my own factory, so I can have 6 potency, 9 potency, 12 potency also if I don't have the potencies, other potencies. Sir, when to prescribe Osimum can medicine? The answer to this, when to prescribe Osimum can medicine, the answer is whenever the symptoms are there, please prescribe. Rather than if you can ask me a question, what are the symptoms of Osimum can, then I'll be able to answer. But Osimum can, if you tell me now, Osimum can basically is a very interesting medicine for urinary complaints. Whatever I remember about Osimum can, whenever I've used in my practice, is basically whenever if you are giving lycopodium to the patient, and the patient says red sand in urine, and you think it is lycopodium and it is not working, if you read mathematics of Osimum can, it is written that urine is brick dust, red sediments, sometimes oily sediments also. So these are the basic symptoms of Osimum can in relation to urine. And one symptom I remember of Osimum can, especially in female complaints, the nipples are very painful on least contact. That is also one of the important symptom of Osimum can. And if I'm not mistaken, Osimum can is basically prescribed for renal colic, especially of the right side. So these are 3-4 symptoms which I remember of Osimum can. You can go home and read more. Okay, sir. I hope it is okay, Dr. Ayush. The symptoms are okay. Sir, kindly tell some medicines for nerve pain when it's unbearable together with muscle pain. I think you're talking about sciatica, and nerve pain is basically complaints sciatica. So I think I've dealt with sciatica exhaustively in my YouTube live. If you have seen my YouTube video, please go and see my YouTube video. I have told a lot of medicine regarding the sciatica pain or nerve pain. You can think about colocin, you can think about phytoleca, you can think about hypericin, you can think about ruta, you can think about, there are so many medicines, you can think about sulfur, you can think about rustox, you can think about, there are a lot of medicines. So this is a very crude way of, either asking questions or prescribing remedies. We always want some symptom to prescribe, there has to be some symptom. Regarding that, I'll tell you an interesting case. I think Dr. Barbel, if I'm not wrong, this symptom this case I don't know whether told in Germany or not. There was a very interesting case that came to me for menstrual problem. The lady was having spotting menses, continuous menses. She was at menopausal age, 50 years of age, since about 2.5 to 3 months. Now the patient had taken allopathy medicines, homeopathy medicine, no change. When the patient came to me, she said, sir, her husband also came to me, says, बहुत menses हो रहे, there are a lot of menses since 2-3 months, not getting better. We have taken all the treatment, but nothing is happening. Sometimes it is, sometimes it is menses with clots, sometimes it is no clots, sometimes only while passing stools or passing urine there are clots. And because of applying so much, sanitary pads, there is a lot of itching in the groins. I have put powder, and the patient was thoroughly confused and thoroughly bored. This was the only symptom the patient narrated. I know she had taken every possible treatment, every possible remedy in the Mater Medica. Only with this symptom, I prescribed one medicine. I prescribed Berberis vulgaris 200 single dose and told the patient to come after 5 days. Berberis vulgaris 200 single dose and told the patient to come after 5 days. The patient came after 5 days and told me, sir, after your medicine, in 12 hours, the menses stopped. Now it is the 5th day, no menses. But I forgot to tell you that whenever I have menses problem, I have pain in my right thigh, and whenever there is pain in my right thigh, I know that the menses will come. And this pain is happening now, which I had 3 months back also. I searched in the repertory, pain in the thigh during and before menses. The remedy was Berberis vulgaris. I prescribed Berberis vulgaris by only one symptom, that is boredom during menses. Only one remedy, and that is Berberis vulgaris. Are you with me? This is the importance of having characteristic symptom along with your disease symptom. If you ask me what is the best medicine for nerve, I'll not be able to tell you because I don't prescribe. I have to have some prescribing symptom, and then the remedy works. I would not use the word magic because it is science. Have you ever prescribed Berberis vulgaris in your life for menstrual complaint? Anyone? Yes, I think I have told this case. Dr. Barbel, an interesting case. So, before the starting of this video, I'd ask you a case of arthritis. The language of the patient, which rubric comes to your mind? Which rubric comes to your mind? Anyone? I have told you a case of arthritis where the patient says, sir, in spite of all the stiffness, I have to wake up and I have to get up and walk. If I don't walk, I'll be more stiff. I have to fight the disease, Now it is a time where I have to see whether the disease wins or I win. This was the wording of the patient. Which remedy, which rubric comes to your mind? The patient was on steroids, on allopathic treatment, and no change. I gave that medicine and the patient improved beautifully. Now after 6 months, no steroids, no painkillers, nothing, on homeopathic treatment, on Phytum. I prescribed few doses of that medicine. So can anybody guess the symptom which I took for prescription? Yes, anyone? Yes, I prescribed the patient hyoscyamus. Again the same condition. Now again the same condition. The patient comes and tells you, sir, I have arthritis. I can bear the pain. But do one thing, that I should not be bedridden because I don't want to be burden on my children or my husband or my grandchild. Ek to do one thing, that relieve the pain, I'll take your medicines for life. But please don't make me a burden on my family. Now this is the symptom what the patient is telling you. One more symptom, I would say a permutation combination. The patient comes and tells you, sir, do something about his arthritis. I don't want to walk with one leg short and one leg more. This is the other. Yeah, I think I have told this. I have put that, I have to put that video. So one condition, arthritis. See how does the patient tell you. This is case taking and this is your remedy, my dear friend. Delusion at being war is a very right rubric you can take for prescription. I took that rubric and prescribed Hyosamus and the patient is better. Second, I've put a Instagram, or I don't know what my assistant doctors have put, but this is the rubric. Fear of being a burden. In that case, I prescribed the patient Raphanus sativa. Raphanus, my dear friend. Have you ever prescribed? Have you ever prescribed Raphanus in your life for arthritis? That is the beauty of homeopathy. That is the beauty of a good case taking and a good characteristic symptom you must get in your case taking. Raphanus sativa, basically a remedy for stomach complaints. I took that to fear of being a burden in case of arthritis. I started with 30, then 200, and the patient is much, much better with Raphanus. The same condition, how the patient presents in front of you is basically the characteristic symptom of that remedy. Are you with me, everyone? That is what I basically teach in my webinars or to my students who are with me. Are you with me, everyone? Are you understanding? Sometimes, it becomes very, absurd that how can you prescribe Hyosamus, how can you prescribe Raphanus for arthritis and the patient is better? And you would say, my God, is that right or wrong? That's why I tell everybody, whenever if you are believing only on YouTube or webinar or some doctors telling on the webinars, don't believe. Unless you know the doctor is doing the same thing in the OPD. That's why I always ask my doctors who are working with me, please see the case taking in front of me. I'll prescribe in front of you and then see the result. So when they see the result with this some rare medicine with some beautiful characteristic symptom, there is a lot of confidence in them. There is a lot of confidence in them. Yes, this medicine also works in syphilitic and autoimmune cases. Are you with me, everyone? Dr. Nitin, I think you must go and do a case taking because your questions are same, numbness, cross-legged. I don't prescribe on this symptoms. I'm telling you, I'm telling you the importance of understanding the characteristic symptoms. Are you with me? And the third part, if you are following me, if you are with me, the third part, the patient says, I have arthritis, doctor, make sure that my one leg does not become default or small so that I cannot walk properly. I don't want to, walk in front of people like walking like this when my hands crooked and I cannot eat my food properly. Make sure that this does not happen. I can bear the pain. This is the patient. This is the patient telling you same symptom, same disease, arthritis. Are you with me? So this is the question I am giving you. What remedy would you give in this patient? The third narrative. Understand the same thing which I am asking you. Okay. So I'll take the question first. LFT is normal, but platelets on one leg, depression and pain in joints due to night weakening, now irritable and wants to sleep. Is it ignitia or Naxomica? Okay. Just a question on my WhatsApp, so I was busy. So let me tell you one thing. If you have done with an ignitia or Naxomica, okay. Ignitia is basically out and out a Chilean thrustless limit, a good boy image, And Naxomica, now we have written night weakening, night watching. In this case, you can think about Naxomica. If I am giving only one option to you, then you must think about if you're giving only two options to me, then you must think about Naxomica. Sir, any specific rubric for delusion of van will come and kidnap and kill? See, I'll tell you one thing, Doctor. All the rubrics, all the things which you have understood in your practice, everything will not come exactly what is written in the rubric. So sometimes, you have to understand and read repertory and rubrics day in and day out. You have to read it. And then try to convert that patient's symptom into a rubric form. Now you have to break your own symptom. Delusion, a van will come and kidnap and kill. Means something is going to come, maybe it is a van, and then it will kidnap you and kill you. So we have rubric delusion that somebody is following you, persecuted, somebody behind you. So there are different these type of rubrics. You can take that rubric. We have 3-4 remedies, and then search for some other symptom which the patient is telling you. Then club it, and if you get if you get that remedy in that rubric, that's your remedy. This is how you will develop your own way of understanding a rubric. Nobody will teach you all the rubrics because he has understood that part, so he will teach you that part. You have to understand that rubric in your sense. For example, the rubric dirty and filthy. Now, dirty and filthy literal meaning, it is like which is but dirty, but that can be dirty thoughts also, filthy thoughts also, filthy thinking also. So these are different things that you have to understand. I hope you understand, my dear friend. Okay. Sir, patient could not sleep due to mother-in-law could not sleep due her mother-in-law is patient. I did not get the question, doctor. Patient could not sleep due her mother-in-law is patent. Mother-in-law is patient. Okay, you can think about Naxomika because you had given only me 2 options, Naxomika and Ignitia. So with that symptom, I would have selected Naxomika. But then if you basically open your if you open your repertory and if you open your Butter Medica, if you had given me more options, I would have given you 3 or 4 remedies which are very, very important that you must think about. You can think about first Naxomika is there. You can think about Coccolus indicus. You can think about nitric acid. You can think about causticum. You can think about I think aurum metallicum is also there in your symptom. So there are 4 or 5 remedies you can think about, and then you can get to your case. Add few symptoms, add a syphilitic symptom if it's a syphilitic case, and then you can get the remedy. Okay, sir, prematurely after prostatitis, don't look at the disease prostatitis. Just see why there is premature ejaculation. In prostatitis, if that's the cause, you can think about sulfur, you can think about belladonna, you can think about ferrum phos, you can think about selenium. Sir, what medicine to prescribe control BP emergency condition? Yeah. So in emergency condition, first of all, if you have LM potency, very good. In low potencies, you can repeat. For example, in high blood pressure to control, but you can think about Rauwolfia. In LM potency, if you get, good. If you don't get, you can use mother tincture also. You can think about Crataegus. You can think about Arjuna. You can think about Ashwagandha also if it is more related to stress. Okay, and these 4-5 medicines you can think about, and you will get good results with that. You can also think about Brata Mure in trituration potency 3x or 6x, whatever available. If you feel in 2 or 3 days the BP is come to normal, then you can take the case and then go and repetize and get a. First of all, you have to ask me whether it is treatable in homeopathy. Yes, I have lots of cases where I have maintained and treated blood pressure with homeopathy medicines only. Sir, a patient had a finger fracture 1 month before, now having swelling after range of motion of finger joint, suggest some medicines. Yeah, Gupta ji, whenever you have a case, of finger injury and already 1 month have passed, very surprising. So you can think about arnica, symphytum, acid sulf, conium, belladonna, ruta, rustox. Should I take 3x or 6x? If available, try 6x potency. Subal soluta, but no, Subal soluta, Subal sir, I have not used 3x, 6x potency. Subal sir, I have used the basic potency, 36, you can use that. Should we always consider thermals to choose a final remedy symptoms match? It depends on the case. If you have a psychosyphilitic case where the thermal axis have been, like thyroid case, like sugar case, like BP case, the thermal axis have been disturbed. So if it is very, very particular, then you can take it. Okay, depends how the patient narrates the symptoms. Thank you for asking so many questions. I'm very happy so that I also have some knowledge brushed up, and thank you all. It's already half an hour up. Thank you for joining me, and I hope you enjoyed as much as I enjoy sharing my knowledge with you. Thank you so much. Until next Thursday for our Instagram live. Thank you.